Namaste. This is Dr. Vinod here, and today I'm going to speak about a condition which causes a lot of pain in the foot in a lot of people, and this is something called plantar fasciitis. It's a fairly common problem, and the pain that people experience with this condition is typically in the heel region. It happens first thing in the morning as soon as they wake up from the bed and they start putting their foot down to walk. They have very excruciating pain in the heel region. It can also come on if the person has been sitting for a long time and then gets up to stand and walk, or it can come on after a prolonged period of standing. Now, this pain usually is very common in women who are between the ages of 30 and 50, but it can happen in men too. There are certain risk factors which increases the risk for this plantar fasciitis to happen. One is overweight. If a person is usually heavier than normal or heavier than what they should be, then it can put a lot of stress on the foot, and this can lead to an increased chance of getting plantar fasciitis. Also, intensive activities like jumping, aerobic activities, running, long distance, this can put a lot of strain on the foot, especially if the foot has not been prepared and ready for these activities. Then it can lead to plantar fasciitis. The pain is usually quite excruciating, and it can limit a person's walking and normal day-to-day functioning. So what causes plantar fasciitis? We all have a tissue which runs underneath the foot between the heel bone and the toes. And this tissue is called the plantar fascia. What plantar fascia means is plantar means the undersurface of the foot, and fascia means the tissue which stretches between the heel bone and the toes. Now, this tissue has got a function. It usually helps to support the medial arch of the foot, which you see underneath the foot, and it also provides some amount of shock absorption when you walk and jump and get on with your day-to-day activities, standing up and all that. So sometimes in some people, this tissue is quite tight and tough or taut, and therefore when these people's feet are then subjected to increasing loads, then it leads to small tears or micro tears in the attachment of the plantar fascia at the heel bone. And this can lead to a lot of pain and inflammation. Essentially, this is what plantar fasciitis is. And if left untreated, then it can last for a very long time. Now, plantar fasciitis is usually self-limiting. It does get eventually better over time, but it may take a few months and grumble along, sometimes even up to a year or two. So once you get this plantar fasciitis pain, what can you do to try and limit this condition and to try to treat it initially at home by yourself? One thing to do is to rest the foot from any kind of impact activity. So if you've been doing a lot of long distance running, walking, jumping, aerobics or sports, then you have to limit the intensity of this activity so that the tissue gets a chance to rest and heal the small micro tears that has happened. The second thing is you can do icing of the area or cold compresses, cold packs. This can be done for about 5 to 10 minutes, 2 or 3 times a day, which will help to reduce the inflammation and the pain as well. And one other thing that you can do is to take over-the-counter medicines, simple anti-inflammatories, for a few days, which will help to reduce inflammation and the pain. And we can also do something called alternating cold and warm baths, which means you put your foot or immerse your foot in a basin of cold water and then keep moving it about. And then you can alternate that with dipping your foot into a basin of warm water. But the most important thing that one can do at home is some simple stretching exercises, both for the plantar fascia, which is underneath your foot and the sole of your foot, and also to stretch the Achilles tendon, which is at the back of your ankle, which is also called the heel cord, because stretching this will also help in resolution of your symptoms. I will be demonstrating some simple exercises that you can do at home to try and mitigate the symptoms when it first happens. These are easily done, can be done by yourself without any external help, and this is very, very much significantly help to limit your problem. So when do you have to consult a doctor? Now, if your pain has been persistent in spite of doing these simple measures, then you may want to see your orthopedic doctor. Now, the doctor might take an X-ray, which might show a heel spur, but this is not the cause for the problem. It is just one of the associated things that they see on the X-ray. and so they might mention that you've got a heel spur. But nothing to worry, there's nothing to be done for the heel spur. Physiotherapy modalities will be suggested, things like ultrasound therapy, stretching exercises, interference therapy. These are all done to try and relieve the symptoms of plantar fasciitis. You can also try footwear modifications by using really soft padded and well-cushioned footwear, or to use silicone gel inserts in your normal footwear, which will help to cushion the heel and thus reduce the symptoms and the pain from the plantar fasciitis. If nothing works, then you may want to consider a steroid injection. Often in cases which have been persistent for a long time and not settling down with simple measures, a steroid injection does work locally and help to relieve the symptoms quite effectively. Surgery is done rarely, if ever, and this is the last-ditch solution once nothing else is working. So I'm going to demonstrate to you some simple exercises that can be done by yourself at home. It's quite easy to do them. You will hardly take about 5 to 10 minutes to do them for each session. And if you do this about 2 or 3 times a day, then trust me, over time the pain will get better. In the beginning, don't get discouraged because you might not notice much of a difference. But if you're persistent and keep doing this every day, then over time things will improve along with the other mentioned interventions. Now for that, you might need certain tools as well. You might wonder what I'm doing with this, a rolling pin, or this, like a ball, a rubber ball, or you could use something like this, which is like a bottle of water. This exercise is to stretch the plantar fascia, so you can use the props that I showed before. You can use a bottle of water, the rolling pin, or a ball. Place it under your foot and then put a bit of pressure down and then roll it up and down, forward and backwards, or even round and round if you're using the ball. This helps to very effectively stretch the plantar fascia, which is underneath your foot. So this combined along with the Achilles tendon stretches will help to relieve your symptoms quite significantly. For this exercise, where we are stretching the heel cord or the Achilles tendon, you have to find a step, which is the bottommost step of a stairwell or some kind of a stepper. You place the front of your foot over the stepper and then let your heels drop. Obviously, you have to stabilize yourself by holding on to something with your arms, but let the heel drop and hold the stretch for about 5 seconds. Count up to 5 and then come back to neutral. And you can repeat this as many times as needed, probably about 10 times or so, 2 or 3 times a day. So those are the simple exercises that you can do to try and relieve the symptoms of plantar fasciitis at home. The key to those exercises is consistency and persistence. So that brings us to the end of this video. I hope you have enjoyed the session and have learned something about the condition of plantar fasciitis and what exercises you can do to try and relieve the symptoms. If you enjoyed this video, do like and don't forget to subscribe to my channel. There will be further videos coming up in the future about various orthopedic conditions. So as always, keep fit, keep moving, and stay healthy. Namaste.
If you liked this video or found it useful, don't forget to like, share, and subscribe. And if you want to be notified of further videos coming up, please do press the bell icon which is next to the subscribe button.